All right, this recording is going to be over cerebral vascular accidents, or in other words, a stroke. These are classified as thrombotic, ischemic, or hemorrhagic strokes. Regardless of the type of stroke, the risk factors are relatively the same. Hypertension, high blood pressure, smoking, diabetes, something called polycythemia, which is a red blood cell disorder, and impaired cardiac function. If we're talking about an ischemic or thrombotic stroke, this is going to come from some sort of occlusion or blockage in the arterioles that go to the brain. This will generally stop blood supply to the brain and the intracranial vessels, and will develop then into a full-blown stroke. Usually these blockages develop from something like atherosclerosis, or the production of plaque in the walls of the vessels, or some kind of inflammatory process that irritates the vessels and causes the production of a thrombus. Embolic strokes are also ischemic type strokes, but an embolus is essentially a fragment of a thrombus that has broken away and formed, and then will go in and cause that fragment to be part of the blood vessel, which will then can lead to the blockage of that vessel, and you end up then again causing the blood vessels to not receive nutrient or oxygen, and you end up with a stroke. The embolus is going to have some other risk factors that occur that are generally a little bit more relevant than just the plain risk factors that we talked about for stroke. Most thrombi are going to produce an embolus if you have a patient that has atrial fibrillation, some sort of aneurysm, particularly left intraocular aneurysm, atrial thrombus, any kind of recent myocardial infarction, as well as something called endocarditis, which is inflammation of the endocardium around the heart, prosthetic valves of the heart, and primary cardiac tumors. One of the things about these is they will form thrombi that are unstable, and a lot of times the embolus then will break away very easily and lead to a significant stroke. Hemorrhagic strokes are going to be the most common types of stroke. These are where you're going to have massive blood formation, generally on the surface of the brain, causing displacement of the brain. Some vessel in the brain has become compromised. It begins to bleed inside or around the brain tissue, and it will begin to compress that brain tissue. You can have massive hemorrhages, which are generally several diameters or several centimeters in diameter. These are usually not compatible with survival. You can have smaller hemorrhages that are 1 to 2 centimeters. These are a little less than an inch. And when you think about the size of the brain, an inch of blood is significant. These can bleed to larger hemorrhages. When we're talking about a massive hemorrhage, this can be 10, 11 centimeters, and those generally are, again, going to be lethal. Slit hemorrhages are going to be the hemorrhages that you see in the areas below the cortical area of the brain, in between the slits of the brain, and you'll see bleeding in there. And then you also have petechial hemorrhaging, and this petechial hemorrhaging are going to be pinprick slits that you see on the brain. When you have somebody who is not receiving oxygen, either because of suffocation, strangulation, something like that, when you do an autopsy, what you'll see on the brain are these small, tiny little pinhead hemorrhages that lead to a diagnosis of suffocation or lack of oxygen. A lot of times you can see these in the eyes as well. The most common causes of any kind of stroke or cerebrovascular accident is going to be hypertension. Blood pressure that is sustained, high blood pressure that is sustained for a long period of time will lead to the progression of a stroke. Ruptured aneurysm or an atriovenous malformation. These are going to be things that are going to cause production of either bleeding that you would have with an aneurysm or atriovenous malformation, or ischemia that you would get with hypertension. Tumors, particularly when you have tumors in the blood vessels or around the blood vessels that will compress, this can lead to ischemia and leading to ischemic or thrombotic stroke. Coagulation disorders in either direction. If you are somebody who produces a lot of blood clots, these can lead to blockages in the vessels that can lead to stroke. Or if you're somebody who doesn't bleed doesn't clot very well at all, this can lead to a hemorrhagic stroke and the same issues with the problem of getting blood to the particular parts of the brain. And then trauma, any kind of trauma to the brain that is significant can lead to stroke. Thrombotic stroke usually is going to be very, it's going to be a little harder to diagnose simply because the symptoms are going to vary depending on which artery is going to be obstructed. Is it a smaller one where you may have just some small issues in cognition, or is it one that has an impact on speech, motor function, those kinds of things? Hemorrhagic stroke, again, is also going to vary depending on the location and the size of the bleed. If you have a relatively small bleed, these tend to resolve themselves, and you don't have as much issue with recovery. The deeper the bleed, the larger the bleed, the more unresponsive the patient is going to be. And the deeper the unresponsive state, the patient is going to be in a deeper state of coma. And a lot of times these patients rarely survive. Diagnosis is going to be with an MRI or an MRA, a magnetic resonance angiography. This is going to be a picture of the blood vessels so that they can go in and look and see if there's a bleed or a blockage in a particular vessel. Treatment for ischemic stroke has to take place within about 3 to 4.5 hours. The treatment is tissue plasminogen activator. This is what they call TPA. This is treatment for both ischemic and thrombotic strokes. What this will do is it will dissolve the clot so that blood flow can be reestablished to that part of the brain. You would never use TPA for a hemorrhagic stroke for the simple reason that it doesn't allow for blood clotting, and you're already having an issue with blood clotting. Treatment is going to be directed at preventing ischemic injury and making sure that blood flow gets back to the area of the brain that was ignored, controlling cerebral edema and controlling any kind of increasing intracranial pressure. Any kind of pressure can lead to deficiencies in the brain, damage to the tissues, and sometimes that damage then can be permanent. Antiplatelet therapy can be instituted depending on the size and severity of the clot. A lot of times things like heparin or some of the newer anticoagulation drugs will be prescribed. Embolic stroke is going to be directed at preventing the embolism, preventing any kind of risk factor for embolizing the clot, instituting anticoagulation therapy to get rid of the clot as quickly as it can. Treatment of intracranial bleeds and stopping the bleeding and reducing any kind of bleeding that may be happening that could increase the pressure on the brain. Preventing any kind of rebleed in the potential for a new stroke, and any kind of prevention of vasospasm. We don't want that clot being pushed any farther into the vasculature. So that's the end of cerebrovascular accidents or strokes. One of the things that I would like you to do is to be sure that you know what the signs of the stroke are. There is an acronym, and some of you probably know that acronym. You need to be sure you look that up and are familiar with that when it comes time for the exam. Again, if you have any questions, please text me or email me. I'll see you next time.